Thank you, Mr Speaker. My question is to the Treasurer in the absence of the Premier. Treasurer, there are 15,061 people on the waiting list for dental care as of April 2022. We know that regular dental visits can tell a lot about whether or not you may be at risk of chronic disease, including heart disease and digestion problems. Treasurer, I note in the budget that there is funding for 5,350 dental appointments using graduate dental professionals. As far as I can see, this is just for the next 2 years, with nothing for years 3 and 4 in the forward estimates. This will still leave far too many Tasmanians languishing on the waiting list. Treasurer, do you recognise that timely dental health intervention can prevent chronic health problems from becoming established in later life, thus relieving the burden on our health infrastructure and services? And do you understand that your government's underinvestment in dental care will ultimately cost our health system more?
Yeah, this is Paul Green's policy.
Honourable Treasurer.
Great idea.
Thank you, Mr Speaker, and I will say I welcome the question from Ms Johnston. That's a question that reflects priorities of Tasmanians. Mr Speaker, it allows me to say that I endorse the spirit of where Ms Johnston is coming from, and in his absence, the Health Minister, the Premier, Mr Rockcliffe. Yep. We are determined to address areas of waiting time and waiting list, including elective surgery and in the area that you've reflected in dental care. We are continuing to address this with a range of initiatives, including, as I think you alluded to, a $5 million investment to provide an additional 20,000 appointments. Now, this is a good thing for the Tasmanian Health Service, and it's an important initiative to support Tasmanians because, as you've reflected in your question, that's a priority for the community, for Tasmanians. So I'm also advised that between April 21 and April 2022, an additional 9,196 appointments have been successfully delivered, and we've recently conducted a number of successful recruitment campaigns in implementing a graduate dentist and therapist program. And I'm also advised that it's due to that recruitment that there have been more than 1,000 appointments made for general care for people on the waiting list during February and March alone. We, of course, recognise that there will be more to do in this area. That's why the budget that is before the House at the moment contains a further $1.5 million for oral health, providing, I'm advised, for a further 5,300 appointments. And so to your question directly, Ms Johnston, the government accepts that good oral health is good for your overall health. That's right. And we'll continue to drive down those wait lists and those wait times as we support Tasmanian families with the priorities that this budget identifies.
Honourable Member for Franklin.